Good afternoon, my name is Michelle and welcome to my presentation on patent ductus arteriosus. A patent ductus arteriosus, or PDA, is a congenital anomaly where abnormal blood flow occurs between the aorta and the pulmonary artery. Before birth, these two major arteries are connected by a shunt called the ductus arteriosus, which is an essential part of fetal blood circulation. Within 72 hours after birth, the shunt is supposed to close as part of the normal changes to extrauterine life. However, in some babies, this duct remains open or patent, causing a circulatory and pulmonary overload on the heart and lungs, resulting in congestive heart failure. A PDA occurs in about 1 to 5,500 infants and is associated with several neonatal comorbidities such as intraventricular hemorrhage, bronchopulmonary dysplasia, and necrotizing enterocolitis. So if your infant has a PDA, they will start showing signs and symptoms such as increased work of breathing with apnea, tachypnea, bradycardia, and increased need for respiratory support. They will have bounding peripheral pulses and a hyperactive precordium, as well as widening pulse pressures and a murmur. To understand the pathophysiology of the disease process, I will first discuss the fetal circulation. So in fetal circulation, the lungs are bypassed and the ductus arteriosus allows deoxygenated blood to flow from the right ventricle and pulmonary artery into the descending aorta and umbilical arteries to become oxygenated in the placenta. Normally after birth, the baby's first breaths increase oxygenation and pulmonary flow to the lungs, which initiates the constriction of the ductus arteriosus. However, when the ductus arteriosus does not close, this is known as a PDA, and oxygenated blood from the aorta mixes with deoxygenated blood from the pulmonary artery. This is considered a left to right shunt, where blood is allowed to flow backward in the heart or pulmonary artery and bypass systemic circulation. A PDA results in diminished cardiac and respiratory reserve due to a high volume of blood being pumped through the heart and the lungs. In premature infants, this can cause pulmonary congestion or edema, as well as hypertrophy of the left side of the heart, and all this can lead to congestive heart failure. The gold standard for diagnosing a PDA is an echocardiogram, and usually once the doctor has read this, they can definitively diagnose the PDA. There are two medications that can be used for PDA. The first one is indomethacin and the second one is ibuprofen, and these both have the expected outcome of closure of the ductus arteriosus. They both can be given IV or PO and given in 3 doses. They're both COX-1 and 2 inhibitors that inhibit prostaglandin synthesis, thereby closing the ductus. As far as drug interactions go, these medications may reduce elimination or increase serum concentrations of drugs that are renally excreted, such as aminoglycosides. There are also interactions with NSAIDs, anticoagulants, antihypertensives, and diuretics. They are contraindicated in cases of renal failure, thrombocytopenia, active hemorrhage, necrotizing enterocolitis, and severe sepsis. As far as efficacy goes, randomized trials comparing these two medications suggest a similar efficacy in duct closure with possibly reduced incidence of renal side effects with ibuprofen. There's a 48 to 95% closure rate depending on the dose, duration, and method of administration. As a last resort, the infant can also receive surgery, and this is called a PDA ligation. A small 1 to 2 inch lateral thoracotomy incision is made where the surgeon is able to see the PDA and close it with a metal clip or suture material. Lastly, prevention, environmental, and genetic factors of PDA are linked to the mother, since a PDA is considered a congenital abnormality. A PDA is associated with prematurity, viral infections of rubella and CMV, maternal medications of anticonvulsants or amphetamines, and genetically affects females twice as much as males and is linked to family members with congenital heart defects. Prevention would ensure that the mother receives good prenatal care, including vaccines and a medication review with the physician to reduce the risk of prematurity that can lead to PDA. That concludes this presentation. Thank you so much for watching.